Hi everyone, I'm Thomas Fitzgerald of Fitzgerald Physiotherapy Clinic. Just going to be posting out some content for people, just giving people some information on different conditions and things. So, first thing I'm going to talk about is disc bulges. Um, Everyone will know somebody who's had a disc bulge, who's thought they've had a disc bulge, or all the rest. So it's a very common thing, something we see a lot here in the clinic. Firstly, just to the phrase disc bulge. I probably don't agree with the phrase totally because it makes it sound as if the disc itself is quite, we'll say, quite weak or not very robust, that it can slip in and out of place. But that's not really true. It's quite a robust structure. So that's the first piece of information for people to take on board. What is it? Basically, you've got your spine or your vertebra, which are the bones, which go one on top of each other like that, and then you've got the disc that sits in between. So it has a couple of different jobs to act as shock absorbers for the spine, helps with a little bit of movement, and also just providing some stability. So what happens is the outer ring of the disc is a fibrous cartilage, which is a bit tougher, and then you've got the inner part which is more gel-like. So over time you can get little micro traumas that cause a little bit of tear of the outer ring, and then the gel-like substance can get pushed out. It can also happen if you have a kind of high speed or velocity impact, say a traffic accident, or if you lift something and twist quite quickly where there's big pressures involved. So yeah, that's what happens when it occurs. Symptoms and things to kind of look out for: pain that gets worse with sitting, bending, or coughing, sneezing. Those are kind of the main ones. And then diagnosing it, you could go to your doctor, your physio, and they'd put you through some specific tests which would show whether you had one or not. And just to make people aware, they're really common. So if we got a bunch of people out in the street there and put them into the MRI scanner, quite a few of them would come out with having some disc bulges or disc problems, we'll say. And there are a lot of those that mightn't have any pain at all. So it's quite a normal thing that happens with aging. So sometimes you can get some tingling, pins and needles, or numbness that goes down your legs. So what happens there is that gel-like substance compresses the nerve, which sends the sensation and the feeling and the power down the leg, and then that can become reduced. So that's a common thing that happens. Can take anywhere between 6 weeks and some months to heal, depending on how severe it is. Best thing to do is attend to your doctor or physio and get some adequate pain relief, so that you can keep moving. So you could get your dry needling, acupuncture, some pain relief from your GP, pharmacist. And then it's quite important to get that feeling of resilience back, and that control back. So that's where you can do a targeted rehab with the physiotherapist, working on your core strengthening, stability, control, all these things that help us function normally again, and lift and bend and do the things that we want to do normally. So yeah, that's just some information about discs, and hopefully you found that useful. And if you have any further questions or anything that you want to ask on it, feel free to comment below or just get in touch to me at the clinic. Thank you.